we will be discussing psychotherapeutic medication, prescription, and over-the-counter drugs. Learning objectives: organize different classes of psychotherapeutic medication and their primary uses in treating mental health disorder. Evaluate how medication are prescribed, including consideration for dosage, potential interaction, and monitoring patients and responses. Differentiate between prescription medication and over-the-counter drugs, including their regulations and safety concerns, understanding common side effects and risk associated with psychotherapeutic and OTC drugs, and the importance of patient education. Critique the ethical and legal issues surrounding prescription of medication, including issues of consent and access to treatment. Before we dive into the content of learning the information for Lecture 6, let's give some reflection on biblical foundation, Matthew chapter 11, verse 28 through 30. Come to me, all who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls. For my yoke is easy and my burdens is light. And this speaks into the grace and unconditional love of God, and how we don't have to do this on our own. We can lean on His kindness and love, and correlates with addiction because it is a heavy burden. People that struggle with addiction go through a lot of different avenues and obstacles to gain recovery. And with His guidance, all things is possible. The promise of rest, we all have to rest, emphasizes the importance of how we connect with our spiritual and emotional and physical healing, if it's not recovery in addiction, or if it's our own mental health and our own obstacles and challenges, that we need to rest and lean on His word and guidance as we deal with our struggles. Early psychiatric hospitals was an eye-opening experience for me to learn about the histories of our psychology. Hospitals did not have the advances of psychotherapeutic drugs to treat patients in the early 1800s. And as you see in this picture, you have the form of treatment that was available during the 1800s, and usually it was restricting the patient and keeping them safe from themselves or harm of others. The first half of the 20th century, physicians tested out different treatments for therapeutic medication. Amphetamines were used for depression and narcoleptic patients, carbon dioxide inhalation for psychosis and neurosis, and antihistamines, insulin shock, and psychosurgery for psychosis. Electric shock therapy still used today for severe depression. In 1949, John Cade, an Australian physician, discovered lithium to help the effectiveness in manic conditions. And during that time, they found the adverse effects of lithium in the 1970s, and there was a delay of use and approval for treatment of lithium treatment. Today, lithium still is used to treat bipolar illness. Classic psychotherapeutic medication that we may be familiar with is the antidepressant classification, the antipsychotic. And going back to antidepressants, it helps with depression and anxiety, such as OCD, PTSD, major depressive disorder, anxiety, which is discussing we'll discuss how the effects are within this classification. Antipsychotic manages the symptoms of schizophrenia and bipolar disorder. And anxiolytics, which deals with treating the anxiety disorder, panic disorder, and insomnia. Mood stabilizers were another classification dealing with mood swings, and stimulants are used within treatment of ADHD and narcolepsy. Early history of anti-anxiety agents was during 1776 with nitrous oxide, the first depressant other than alcohol to be used. The discoveries of that during this time, there was a lot of skepticism around the use of nitrous oxide for many years. Today, nitrous oxide is widely used in dentistry and in certain types of surgery. So that is, even like with history, like the substance, without the experience and understanding of the drug, that's led to how better treatment was given over time. Rather, William Morton successfully used breath inhalation to render a patient unconscious in the first public demonstration of surgical anesthesia. Again, in toxicology results, with Michael Jackson, we learned a lot about overdose and the impacts of medication through his experience, and he died of an overdose of propofol, a powerful sedative and anesthetic, sometimes prescribed for insomnia. On the day Jackson died, his doctor also given Jackson diazepam, Valium, Ativan, and Versed. So mixing those drugs caused the unfortunate death of Michael Jackson. How medications are prescribed, and we'll discuss some of the ethical issues and considerations when we prescribe medicine. Within history, even diagnosing and mental health, we discuss the symptoms, history, and needs of the patient, and we discuss most prescriptions are prescribed by an appropriate dose, considering the patient's weight and also the severity of the conditions. It should be monitored by regular follow-ups, assessing the effectiveness and the side effects, and adjusting the doses as needed with the feedback and the checkups that are done to follow. Psychotherapeutic medication during pregnancy is an issue due to the risk of birth defects. Teratogenic risks or birth defects caused by taking drugs. Risks of prenatal syndromes and neonatal toxicity, and then there's negative effects on child development. Again, with the research, although there is risk within taking these medications, there are also limited research available for making that decision. And considering that being a sticky topic, there is hard to get consistent research with testing and the willingness to test the impacts of the medication on pregnancy. It's a fragile developmental stage, regardless if there's a substance or not, or if there isn't a substance involved. So considering those components, there is the scientific assumption and the consistency of understanding adverse effects on how it could impact pregnancy. Prescription medication versus over-the-counter drugs and the differentiation between both. Prescription drugs are regulated by FDA or a required doctor, and it should be assessed and regulated by those assessments and follow-ups. OTC drugs, over-the-counter drugs, are available without prescription. So there are, at times, most of the time, OTC drugs come with directions and precautions, but it's less stringent and it is follow-up independently monitored. In both, there are risks because you get a prescription drug that is prescribed by your doctor, but it's up to the patient to take it as prescribed and as needed. So it's important for us to understand and read the labels. When you don't read the label, you can miss not eating and it causes adverse effects. But if you eat something with the medication, you wouldn't get the adverse effects. So reading and comprehension and understanding the drug is important. I've, in my experience, going to get a drug or get a prescription drug or over-the-counter drug, there's not always consistent education. They ask you if you need it. I think you should just get it regardless, but sometimes we don't follow through with that. And if there is some impairment in cognitive ability, or there's problems with comprehension, then there can be these mishaps. Common side effects or risks within psychotherapeutic medication, OTC. So psychotherapeutic medication can cause nausea, weight gain, fatigue, and dizziness, and risks of dependence that are more prominent with benzodiazepines. OTC, possible side effects are allergic reaction, gastrointestinal issues. Risks include misdiagnosis and inappropriate use. Again, proper education can prevent some of these issues for prevention. Here's a list of different FDA classification of over-the-counter drugs that we're familiar with. Herbal products, hormones, and dietary supplements. That is another risky and ethical considerations that need to be made. In 1994, the Dietary Supplement Health and Education Act reduced the authority of FDA to regulate herbal and other biological products that often contain psychoactive drugs. Can be, like I said, we're on the fence of how to regulate certain natural products such as vitamins, herbs, amino acids, and other hormones. It can create serious adverse effects if there's an issue with mixing up with other chemical properties of psychotherapeutic drugs, OTC drugs, and then the mixture of these supplements. An example is a GHB was marked legally as a supplement until medical complication use led to it be a Schedule I status. So if there's a prominent issue with one substance and it creating serious effects, adverse effects, well, is when the FDA will get involved to classify the drug in a different status. We spoke a bit about the ethical legal considerations, and it's important for the patient to understand the risk and benefits. and having a conversation and asking questions. If you're not sure, then ask questions. I always ask questions because sometimes one doctor may prescribe something and your PCP may prescribe something. Usually, and they should ask, what prescriptions are you taking now, to make sure that the medication doesn't cause any adverse effects. But it's imperative to look into and make sure that you are aware of when you're mixing drugs, especially the ones that you buy personally.